As President Obama prepares for a future beyond the White House, the future of Obamacare remains uncertain. And the next president will have to grapple with a series of setbacks facing the Affordable Care Act. Major insurance companies like United Health Group, Humana, and this week Aetna have announced plans to pull out of state insurance exchanges, citing heavy losses and mounting medical costs. As competition dwindles among insurers in some areas, the fear is that premiums will rise, and some Americans may even be left without health insurance options. So what have presidential candidates Hillary Clinton and Donald Trump proposed when it comes to health care?
I want to defend the Affordable Care Act. It is one of the great accomplishments, not only of this president, but of the Democratic Party going back to Harry Truman.
Clinton, who has made access to health care a priority throughout her career, has laid out a number of proposals to build on Obama's signature law. That includes plans to expand Medicaid, cap out-of-pocket costs, double funding for community health centers, and even pave the way for a public option. That's a government-run health insurer that competes with private insurance companies. America's Health Insurance Plans, a trade group that represents more than 1,000 companies, tells the Wall Street Journal that it supports plans to expand coverage, but that a public option would not improve competition, consumer choice, or quality of care. It also says that capping out-of-pocket costs for prescription drugs would lead to higher premiums for consumers. So, what about Trump's plan? The Republican presidential nominee has vowed to try and repeal the Affordable Care Act altogether on his first day in office.
We'll replace it with something so much less expensive and so much better. It doesn't get worse.
On his website, Trump says he'll work with Congress to implement a series of reforms, like removing barriers which have made it difficult for insurers to compete across state lines, allowing Americans to deduct health insurance premiums from their tax returns, and requiring price transparency from doctors and hospitals.
I'd rather get rid of it and have a beautiful new plan and concept. I would much rather repeal it than replace it.
While Trump is clear that he wants to start from scratch, America's health insurance plans say they have yet to see full details on his repeal proposal, and that jumping from one major reform to another without a transition plan in place could ultimately hurt consumers. According to the Kaiser Family Foundation, insurance premiums are expected to rise an average of 9% for the benchmark Silver plan in 2017, faster than they have in previous years. As of February, roughly 12.7 million Americans were signed up for coverage under the Affordable Care Act.